Hi, my name's Lexi, and the topic I have chosen for my research paper this semester is sexual abuse and sexual assault of children and how it affects them long term. A few things I've learned. 1 out of 3 women actually are sexually abused, and 1 out of 6 men are abused. And the effects are the same for men and women usually. Fear is the most common felt emotion after sexual abuse has taken form, whether it be fear of reoccurrence or fear of seeing the person, fear of telling the authorities. A lot of fear can be associated after the attack. Family sexual abuse is actually the most common type of abuse, and if it is family-related abuse, it increases the anxiety and depression symptoms that can be associated with sexual abuse. A lot of the articles I read said self-help is the first step to recovering after abuse, like setting appropriate boundaries for relationships or friendships, or making sure you are eating and showering, brushing your teeth, brushing your hair. Counselors, therapists, social workers, teachers need to pay attention to the signs that can be associated with sexual abuse. Oftentimes, if it's family related, they don't have the chance to tell anybody, and it's hard to tell somebody, so it's important to pay attention to the signs. Every person has a different experience, meaning every person has different long-term effects. UTIs, bleeding, uncomfortable sex are all long-term effects. Also, reproductive issues, like having children, can be a problem. IBS, or irritable bowel syndrome, is also well-known associate after sexual abuse. I think one of the articles said up to 70% of people with IBS have actually been sexually abused before. Most cases of abuse aren't reported to the authority, which kind of makes it difficult for some of these studies to do research. And it's really important for the stigma or the guilt or shame that's associated around rape needs to be gone so that people are more comfortable with coming forward. There's a long, disturbing list of a spectrum of a way a person can be sexually abused, ranging all the way from being forced to look at pornographic pictures to forcing intercourse with the child. After such memory has taken place, there's usually 2 courses that can happen to the memory. The first course, or one of the courses, is the memory is repressed, and oftentimes for some people, the memory was later recovered after a certain amount of time period, or a certain trigger had happened, but I wasn't so sure if the memories were so accurate. And then the second route that a memory can take is like a flashbulb memory, which is a very, very vivid recall of what happened, which oftentimes also isn't 100% accurate, but that's all having to do with poor encoding with the brain while the occurrence is happening. Substance abuse is an often common problem that occurs later in life in people that have been abused, and subsequently it passes along oftentimes to your children when you are a substance abuser. A lot of articles discuss the fact that more screenings, questionnaires, and questions should be asked at doctor's office and at school, because only 5% of people report abuse to their doctors, according to one of the articles I read. Also, there wasn't much information on the justice system and if the justice or putting the person in prison or jail makes a difference in these effects. And that was something I was really trying to do a little bit more research on. So if you have any suggestions on where to find more information on the justice system and how justice can make a difference, or if it doesn't really make a difference. Another problem that I really had was length. I believe without my annotated bibliography, I had about 7 or 8 pages of solid, good evidence, but I think I wanted to go through my sources again and maybe use them twice if that's okay, because I did only use the sources once because I didn't really know if it was appropriate to use them twice, but I'm assuming it is, so I think I'm going to go through my sources again and see if there's some more information I can pull out of those. I also wasn't really a fan of my conclusion. I mean, it wraps everything up, but I don't think it does it very adequately, so if you have any suggestions on the conclusion, that would be great, or basic things to suggest, I suppose. Yeah, thank you.